Um, Today's topic is metabolic response to injury. Why this topic is important? It is due to restoration of the tissue function. Our body has unique way of protecting us. So if any injury occur, it may be trauma or maybe a surgery, it can give rise to restoration of tissue function, and second is eradicate invading organism. For restoration of our function, body function, some things will be coming, some response will be there in our body. So in this objective, first is the homeostasis. Homeostasis. Actually, the homeostasis means how our milieu interior, we call it milieu interior. How we will maintain this milieu interior by the response of our body. We usually call it as a, not hemostasis, it is homeostasis. Maintenance of the interior of the body, milieu interior of the body. Then components of response we'll be talking. Then mediator of response. Then phase of response and key elements. Then factors, exacerbates and avoidable things will be there. So we'll be talking about these objectives. So what is homeostasis? Maintenance of the nearly constant condition in our internal environment. Internal environment means milieu interior. So to restore it, the homeostasis is there in any trauma or any surgery. Essential of organs of tissue of the body perform functions that have maintained this constant condition. So basic concepts of homeostasis. So essentially all organs of the tissue of our body perform functions that help maintain this constant condition. So this maintenance of any injury or anything will be done by all the organs of our body. Most important is the liver as well as our brain or our nervous tissues. All those will doing their work to maintain this. So basic concepts of homeostasis is Can you see properly? So homeostasis is the foundation of normal physiology. The stress-free perioperative care helps to restore homeostasis following any injury or surgery. Then resuscitation, surgical intervention and critical care can return the severely injured patient to situation in which homeostasis become possible once again. So due to any trauma, the milieu interior of our body will be trying to maintain this body function. So nature of injury response is metabolic response to injury is graded into evaluate with time. The injury occurring just now, having the response from the body is different. There are three types of things we'll be seeing. One is immunological problems, one is cellular response and the hormonal response. Those three things will be there. One is immunological, one is cellular response and another is hormonal response. So three types of response will be trying to restore our body function. So response components are physiological consequences. What are the physiological thing will be changing? Another is metabolic manifestations, then clinical manifestations and the laboratory changes. So these are four changes we'll be discussing about. So response components, physiological is the cardiac output will be increased. There will be ventilation, patient will be having more ventilation, increasing ventilation. His respiratory rate will be increased. Then membrane transport will be increasing. Another is patient will be having weight loss, then there will be wound healing. So these are few physiological changes will be occurring after injury. Then metabolic, what are those metabolic changes? One is hypermetabolism. Patient is having increased in the metabolic rate. Hypermetabolism we call it. Then accelerated gluconeogenesis. Accelerated gluconeogenesis. Then enhanced protein breakdown. The protein in our body tissue protein will be breaking. So another is increased fat oxidation. So these are few metabolic changes will be occurring after any injury or any surgery. Response components, clinically you will get patient will maybe having fever, then tachycardia, then tachypnea. You know what is tachycardia? Increase in the heart rate. How much is normal heart rate? Normal heart rate, how much? It is 72 usually. What is bradycardia? If it is less than 60, this is bradycardia. If it is more than 80, we call it as a tachycardia. So the tachycardia will be there. Usually with fever also. If patient is having fever, his heart rate will be increased. Okay, so tachycardia will be there. Tachypnea will be there. Tachypnea means the respiratory rate is increased. Usually respiratory rate is up to 16 per minute. But in this case of any injury, the tachypnea can occur. Then presence of wound or inflammation will be there. There will be wound or inflammation in that tissues. Then anorexia. What is anorexia? Loss of appetite. Patient may not feel like eating. So anorexia is another clinical feature can be presenting after injury. Then laboratory, if we go for some investigations, the leukocytosis will be there. Or some cases, severe cases, there may be leukopenia, less WBC count. Leukocytosis is more WBC count. Normal is how much? Physiology to পড়িয়েছে তোদের? They told you how much leukocytosis, especially the polymorph, how much is normal? 12,000 per cubic millimeter. So if it is more than that, we call it as a leukocytosis. But if it is less than this, we call it as a leukopenia. Then patient will be having hyperglycemia. Blood sugar level will be increasing. Hyperglycemia we call it. Then elevated CRP. C-reactive protein is increased and altered acute phase reaction. There are few reactions are there from our body. The acute phase reaction will be increased. Then hepatic and renal dysfunction will be there. Hepatic dysfunction, the bilirubin level, the other enzyme level may be increased in some cases, and renal dysfunction, urea, creatinine, they will be deranged. Urea may be increased, then creatinine level also may be increased. So these are few laboratory findings. When there is a trauma, we can get these type of features. There are mediators of injury response. What are the mediators? First is neuroendocrine or hormonal response. Neuroendocrine or hormonal response. Second is immune system, cytokines will be deranged. Cytokines may be increased. So these are few mediators of injury response. One is neuroendocrine response and is immune system, cytokines response will be there. Next. So what are those neuroendocrine response to injury? It is biphasic, acute phase and chronic phase. There are two types of things we will see here. One is acute phase. In acute cases, there will be secretion of pituitary and elevated counter-regulatory hormones. Usually cortisol, glucagon, adrenaline, their level will be increasing. and they are beneficial. They are beneficial to our body, to our tissues. So usually this is this is needed for short time survival. In short time survival, you have to go for this acute phase. Then come the chronic phase. After 48 hours, patient may be having chronic phase. What will be there? Hypothalamic suppression will be there, and low serum level of respective target organs hormone. Changes contributing chronic wasting. There will be contributing in the acute wasting is there, chronic wasting also there. There will be our muscle mass will be breaking down, so patient's body will be lean and thin. He loses weight. So this is seen in case of chronic phases. Next, this is a picture showing. It started from the spinal cord, brain, and the pituitary is very important. Then plasma, ACTH, then gluconeogenic hormone, then diffusion cortisol, those are increasing. Glucagon is increasing. Then interleukins, interleukin 1, the tissue necrotic factor alpha, the interleukin 6, interleukin 8. These are few things will be seen in plasma which will be increasing. Then corticotrophic releasing hormone, CRP, CRF releasing from the hypothalamus increased. They increase the adrenocortical hormones, ACTH will be increased. Usually they are released from the anterior pituitary. So anterior pituitary is secreting ACTH, then act on the adrenal, the ACTH, then act on the adrenal to increase the secretion of cortisol. The cortisol level will be increased. Then hypothalamic activation of sympathetic nervous system causes release of adrenaline and also stimulate release of glucagon. So adrenaline will be surging, adrenal will be. These are usually stress hormone. Stress, when there will be any stress or any injury or any surgery, these hormones will be, adrenaline will be increasing, then glucagon will be increasing. Intravenous infusion of cocktail of these counter-regulatory hormones, glucocorticoids and catecholamines, the producers may aspect the metabolic response to injury. So this hormonal level will be increasing and they are maintaining our response to the tissue. Then innate immune system, primary macrophages interacts in the complex inner manner with the adoption of immune system. T cells will be increasing, B cells function will be changing in co-generating the metabolic response to injury. So these are all the tissue of our body, from nervous system, from the corticosteroids, then adrenal and other things, or the tissue system like blood cells and other things will be increasing. So these are few things in the metabolic response. Another is why this neuroendocrine response is needed. What purpose? Is provide essential substrate for survival. So for our survival after injury, these substrate are important and they are providing essential substrate for survival. Second is they postpone anabolism. Then they optimize host defense. Host defense is increased. Host defense is important for our survival. Means any bacteria or anything invading to our tissue injury, they will be optimizing this host defense of our. Then what are those immunological response? One is pro-inflammatory phase. In pro-inflammatory phase, there will be interleukin 1, interleukin 6, TNF-alpha, hypothalamus and will be stimulated, give rise to pyrexia. There will be fever in those patients. Then hepatic acute phase protein will be increasing. There may be it can change into SIRS, Systemic Immune Response System, then MODS. If it is, this response is more, in that case SIRS and MODS will be the one. This response will be increasing. Then what is the counter regulatory phase? One is interleukin 1 receptor agonist. How you can help, how these things which these hormones are increasing, interleukins and other things are increasing, how can you regulate this phase? One is interleukin 1 receptor agonist maybe is available, interleukin 1 receptor agonist, and TNF soluble receptors, TNF, these receptor agonists are available. They can help to counter this acute phase, counter regulatory phase. Then component anti-inflammatory response syndrome, we have to counter by giving some injections of corticosteroids or some other interleukin. The receptor agonists are important for us. We can give it to restore those things. So there are few phases of restoration. It is usually started by David Cudberson in 1930. So Cudberson given these phases. One is Ebb phase, another is flow phase, then recovery phase. Ebb phase, flow phase, and recovery phase. So this Cudberson has divided into Ebb phase and flow phase and recovery phase. Actually, Ebb phase is occurring within hours. Then flow phase is days. Then recovery is going into weeks. This is the way of restoration of the body functions. Ebb phase, there will be few changes. I have told you the interleukin and others will be changing. The breaking down of energy stores will be in flow phase. There will be breaking down of energy stores, and recovery will be there in weeks, building up of used energy. The energy we have used for this trauma or surgery, it will be recovered within weeks. What is Ebb phase? It is occurring within 24 to 48 hours. Then what is its role? One is conserve blood volume and energy reserve. Repair will be there when this has the role of the Ebb phase. Then physiological changes. BMR is decreased, temperature is decreased, carbon dioxide, hypovolemia will be there. Then there will be lactic acidosis in these cases. Physiologically, you can get this type of features. BMR decreased, temperature decreased, then carbon dioxide hypothermia will be there. Then lactic acidosis may be there. Then some hormones will be also, like catecholamines, cortisol, aldosterone. So these three types of hormones may be changing in this case area. In flow phase, usually we call it as a catabolic phase. It occurs within 3 to 10 days. The catabolic phase, 3 to 10 days. Then metabolism of energy stores. Catabolism 3 to 10 days. Metabolism energy stores will be recovered and repaired within these 3 to 10 days. Then there will be increased in BMR, increase in temperature, increased in oxygen consumption, and increased in the cardiac output. CU is cardiac output. Then what will be there in hormone level? Cytokines will be increasing, insulin level will be increasing, glucagon also they will be increasing. Then cortisol, cortisols, catecholamines, but insulin level restorations. So, but the insulin resistance may be there in this type of features. Insulin resistance. So, what are the metabolic changes? It occurs in 10 to 60 days. It occurring in 10 to 60 days. what will happen? The replacement of lost tissue will be there, then positive nitrogen balance will be there, then growth hormones and GFR level will be increased. So these are occurring in case of ebb and flow phase. So usually key catabolic elements in the flow phase is hypermetabolism. Patient will be metabolize hypermetabolism. His metabolism is increasing. Then alterations in skeletal muscle protein. The skeletal muscles protein will be decreased. There will be breakdown of skeletal muscles. Alternations in liver proteins will be there. Then insulin resistance will be there in these cases. Then there will be hypermetabolic phase. What is hypermetabolic phase? It is occurring majority of trauma patients. The energy expenditure is usually approximately 15 to 25%. Then it is more than predicted health resting values. Resting below it is more. The expenditure is more than the resting value. It is 15 to 25%. Factors which increase this metabolism is due to central hyper dysregulation. Central hyper dysregulation. There may be increased sympathetic activity, then increased protein turnover, then wound circulation abnormalities will be there. So these are few factors when the catabolic phase is gone, then hypermetabolic phase will be there. In metabolic phase, skeletal muscle wasting result of increased muscle protein degradation, then plus there is muscle protein synthesis in the respiratory system and GIT. Cardiac muscles is spared in this case. Heart will not have any function, any injury to that. Heart is functioning properly, but other muscles like skeletal muscles, they may be wasting due to this injury. Then second is mediated at a molecular level mainly by activation of the ubiquitin protease pathway. There is some pathway, ubiquitin protease pathway. Then third is it leads to increased fatigue. Patient will be fatigued, weakness will be there. Then this reduced functional ability. Patient may not walk properly. He may be having weakness. So then decreased in quality of life and increased risk of morbidity or mortality. In those patients, if after trauma there may be having quality of life is decreased, he may not maintain his normal lifestyle or working properly, then there will be risk of morbidity and mortality. Then hepatic acute phase response will be there. Usually there will be cytokines, interleukin 6, then there will be increased synthesis of positive acute phase protein, usually the fibrinogen and CRP. C-reactive protein will be increased. Then negative acute reactants like albumin decreases, then they are not compensated. They are not compensated in this phase. So this is chronic changes. Due to the hepatic changes, there may be these problems may occur. There will be insulin resistance. Insulin, which is secreting from our pancreas, islet cell of Langerhans. So the hyperglycemia is seen in these cases. There will be glucose production increased, decreased glucose uptake, then peripheral tissue transient induction to insulin resistance. Insulin, even you are giving, patient will be having hyperglycemia. So even you give the insulin, his insulin will not function. The resistance will be there, insulin resistance. The activity of insulin may not be possible, even the hyperglycemia is there. Then due course cytokines and decreased response to insulin, regulates glucose transport proteins. There will be insulin regulates glucose transport proteins changes. Then the degree of insulin resistance is proportional to magnitude of the injury process. How much injury is there? It is proportional. The insulin resistance is, if it is more severe, resistance will be more. So these are insulin resistance. Okay. Next. So what are the changes in body composition following surgery or critically ill patient? There will be catabolism, decrease in fat mass and skeletal muscle mass. Skeletal muscle mass and fat mass will be decreased. Body weight paradoxically increases because of extension of extracellular fluids. Usually fluids will be accumulating, and initially patient will be having weight change, gain in weight, but later on the weight loss will be there. Body weight will be decreased. Then there will be hypothermia. Patient may be having hypothermia. The body temperature will be decreased. Then pain will be there. Due to the tissue injury, patient may be having pain. Then starvation may be there. Patient may not take, due to anorexia, he may not take proper food, starvation will be there. Then immobilization is very important because patient cannot walk properly even after prolonged surgery. This immobilization is there. Due to that, patient may be having these changes. Then patient may be having sepsis. The bacteria may be growth and they can give rise to septic shock or something due to the septicemia may develop. Then hypotension will be there in severe cases. So these are the few things, factors, increased response to the injury. Then what are those avoidable factors that compound the response to injury? Avoidable factor, which the factors we can avoid. One is continuing hemorrhage, which may be decreased. The blood loss may be reduced by different methods, compression, then giving blood transfusion. Then you have to keep the patient in a room where temperature is normal temperature. Then hypothermia should not be there. Tissue edema should not be there. Then tissue hyperperfusion should not be there. Then starvation should not be there. Patient should not be asked not to take food. So starvation is avoiding. Then immobility. So as quickly as possible, we should ask the patient to move. Even patient is recovered from surgery, we should, as quickly as possible, we should ask the patient to move properly. Then these are few points can restore those injuries. Okay, next. Another thing is avoidable factors. One is volume loss, central infusion of intraoperative admission of colloids and crystalloids, so that there is net weight gain. So the fluid balance has to be maintained. Central fluid catheter has to be there. Central line has to be done, and we should give proper volumes, which is usually colloids and crystalloids. It should be increased, and there is no net weight gain if you give these things. Then hypothermia. Maintain normothermia by upper body force, air heating cover. The body has to be covered properly. Some mechanisms, some blankets are available. If it is patient is in a cold area, usually Europe or some other countries, these methods has to be used, not to allow the patient to have hypothermia. Next. Then administration of active protein C to critically ill patient has been shown to decrease organ failure and death. It is thought to act in part via presentation of the microcirculation in vital organs. So the administration of active protein C, which can be given to those patients. Injectables we can restore this situation. Maintain the normoglycemia with insulin infusion. During critical illness has been respond to protein and metabolic and thereby contribute to the prevention of organ failure and death. So insulin may have some role. Insulin, as there is the insulin, the hyperglycemia is there. The insulin may restore the normoglycemia patient will be having. By infusing insulin, the normoglycemia may be maintained. Then starvation should be avoided. During starvation, a body is faced with an obligate need of generate glucose to sustain cerebral energy metabolism. Means 100 gram of glucose per day is needed in those injured patients, and we should avoid starvation as quickly as possible. Whenever you patient can take orally, you should start feeding the patient. Then provision of at least 2 liters of IV 5% dextrose per for fasting patients provide glucose as above. So this 100 gram of glucose per day is needed for those patients. We have to avoid the starvation. Tissue edema should be avoidable. It is mediated by a variety of mediators involving in the systemic inflammation. Careful administration of anti-mediators and reduce fluid overload during resuscitation reduce this condition. Tissue edema should not be, we should not allow the tissue edema to occur. So the fluid balance has to be maintained. IV fluid has to be given. Then immobility. So immobility is very important sometimes. You should not allow the patient to move, but recovery phase, you ask the patient to start walking. So immobilization may be, you should not allow that. Sometimes it may be needed because patient is acutely ill. You have to ask the patient to take bed rest, not to move more. But when he is in a recovery phase, you ask the patient to start walking, start doing some walks. So this will restore the immobility. Part of this necessary aspect of tissue response is minimal access techniques. We are talking about surgery. If you do the minimally access techniques, we will not go for laparotomy by open method. Sometimes laparoscopy is sometimes helpful. So minimal access techniques are suggested. Then minimal periods of starvation we should do. Starvation, we should not ask the patient to starve for more than 24 hours. So we should stop that, though starvation should not be done. Then epidural analgesia is important sometimes. Epidural anesthesia is better than general anesthesia. So general anesthesia having many problems. So to avoid that, we go for epidural anesthesia or spinal anesthesia also. These days for gallbladder operation, we are open surgery, we are doing the spinal anesthesia also. By that, you are avoiding the extent of injury. So, and we should do the early mobilization. In any surgery, you have to ask the patient to move. After patient recovered, then ask the patient to move, mobilize the patient. You ask the patient to sit down, or you can also help him to sit down and tell the attendant to make him mobile. So this early mobilization is very important in this case. These are a few questions asked. Metabolizing nitrogen excretion are related to the degree of stress, which are correct. We have some points. In such a situation, are physiological, metabolic, or immunological changes. The changes cannot be modified. The mediators of the integrated response are initiated by pituitary. So, which is correct? After reading those, you can make out. which is correct. This is the B. In such a situation, there are physiological, metabolic and immunological changes. So this is the B which is correct. Next. Another is all the following hormone regulate in the Ebb phase except which one? Glucagon, cortisol, aldosterone or catecholamines. In Ebb phase, which hormone is important? This is a D. Catecholamines will be increasing. Next, which one of the following is not exacerbated in the metabolic response? Which are these points? Hypothermia, hypertension, starvation, immobilization. Which is not exacerbated in metabolic response to tissue. Which one is correct? Hypothermia, hypertension, starvation or immobilization. Why immobilization or not? This is immobilization. Ask the patient to quick mobilize the patient. Next, which one of the following statements are false regarding optimal perioperative care? Volume loss should be promptly treated by large intravenous infusion. It is correct. Another is hypothermia and pain are to be avoided. Correct. Starvation need to be combated. Avoid immobility. So D is, I think, not correct. This is false. Next, which one of the following interleukin prompts the hepatic acute phase response injury? Which is there? Interleukin 4, 5, 6, 8. Interleukin 6 is correct. Okay. So actually this topic is difficult. So what are those things happening? You should remember the phases, Ebb phase and flow phase and recovery phase. How much will be there in how many hours it is there, how many hours for flow phase and recovery phase is later on. So what are those hormonal changes, what are the hormone helping the patient, and what are the things not to be done. So these are few important things. You can consult your books also, it has been given. Okay, so I think I should stop here. Thank you again.